What my talk is about life at the cutting edge of medical-dental integration. And so, what is medical-dental integration? It seems simple, but it has some different dimensions. And I've been thinking about this for quite a while, at least the point in time when I first came here and started working in the dental system with Jack Hollis, where we were doing designed an integration research program and for smoking cessation to get people to health education and so they can get services. And since then, I've been thinking about it a lot, and been as I move more into dental research. But one of the things I thought about, medical dental integration is that there are different dimensions of it. First, there's organizational structure. So here in Kaiser, we understand that our medical system, our dental system, is in a single organization. And in fact, patients themselves, when we ask them about what they feel about dental and medical integration, they go, I thought you guys were integrated. And so we have to actually we have to teach them or learn from them that there's an expectation about medical dental integration. But as an organization, we can use our organization, Kaiser Northwest, as a facilitator to create relationships. We have a single health record number. We can do things internally that other organizations can't without HIPAA concerns and contracts and all that. Informational, there's an integration. We again are in a great environment where we have Health Connect. We've had it since 1996 on the medical side. But there are different degrees of integration of dental and medical care and along electronic records. And so you can go from paper charts to electronic dental records that don't integrate or don't speak to the EHR, the Health Connect, or now, finally, we have one that's fully integrated. So we've had all three systems of levels of integration or disintegration within Kaiser on our dental plan. So how this affects us and why it puts us at the leading edge here, and especially if we go back to organizational. I was at a conference last fall at Harvard where different organizations and insurers and researchers were getting together and trying to figure out this medical dental integration piece. And they were, there were different projects that had brought together data, and they were focused on the transactional relationship between patients and providers. And they were coming at it from either the patient end or from the provider end, but they couldn't do both. And I thought to myself, boy, we're light years ahead. Because we have everything integrated. We have an organization, we have co-located clinics, but now we have, at Cedar Hills, we have a fully integrated workflow, and that's a watershed for us. So we can connect patients, so patients go, they check in, they get their dental care, they get some primary care services, they check out, and we can do it all at once in an embedded health record system. And so that puts us at the cutting edge. No one can compete with that. And now it's up to us to go and explore that and combine our data systems to use it. And we have this opportunity to develop a learning health system and to use the dental plan as a laboratory for establishing an operational learning health system within the dental system that then can become a model for the broader medical system, with CHR at the becoming the spoke of the wheel that pushes this integration. And that's what we can do. And I hope some of you will join us in doing it. Thank you.